On the debate tonight, over 100 deaths in 16 days. Bihar is witnessing one of its worst encephalitis outbreaks this year.
Why is health such a poor sector? And why do our children have to pay the price? On the show with me, Dr Samir Dalwai, spokesperson of the Indian Academy of Pediatrics. He's also with us. Dr Dalwai is the spokesperson for the Indian Academy of Pediatrics. Dr Dalwai, if it can be done in UP, it can be done in Bihar. Something went horribly, horribly wrong here.
Something is going horribly wrong every year, and what I'd like to say is the first point is we should stop treating this like a train accident or a disaster and then be prepared for the ICU to deal with it. That's the first mistake, because the ICU, of course, we did a story on Gorakhpur last year and we know how badly the hospitals are equipped and we know how the doctors are getting blamed for everything, but that's a different issue here. Here we must understand what are we dealing with in Bihar. Encephalon is the word for the brain. Encephalitis is anything that affects or infects the brain. And like Dr. Nair said, either a virus or a bacteria or a fungus can infect the brain, but also a toxin or a poison can infect the brain. Now let's go to this issue in Muzaffarpur. Over the last 8-10 years, a team of doctors from Indian Academy of Pediatrics, whom I represent, has studied the epidemiology of this condition. So all the children who are falling prey to this encephalitis have a pattern. All of them are malnourished. Most of them are below 5 years of age.
Yes.
Obviously, all of them are impoverished. You see the pictures. You're not seeing any deaths in the hi-fi hospitals. They're all government hospitals, poor patients. And then this happens just before the onset of monsoon, where the summer is at its peak and where children are dehydrated. So now you have a poor, malnourished child, more females than males, who is malnourished, who perhaps has not been vaccinated, who comes from a family who cannot give him food, and now in this dehydration, in this summer he's dehydrated, he's foraging around for food, perhaps he comes across some rotting lychee or some other fruit, and then when he eats it, this toxin with a combination of a malnourished, impoverished child, at night releases some toxins which decrease the glucose level, like Dr. Monga said. And this is leading to sudden acute hypoglycemia at night, which damages the brain, and suddenly the child is found unconscious, lethargic, drowsy or convulsing in the morning. Then starts the story of reaching out to the local public health center, which is not equipped, which is not trained, finding an ambulance which may not be there, driving all the way a few hundred kilometers away to a city. Now please understand, the Indian Academy of Pediatrics has, the president Dr. Digant Shastri has written to Honorable Cabinet Minister Harshvardhan ji that we are there to help you with it. But please understand what science is saying. Science is saying that all these are preventable if you look at the right place. The prevention doesn't happen in the ICU. Of course, have a great ICU. Yes. But the prevention is in the prevention of malnutrition, in the prevention of low birth weight, in the prevention of premature babies, in adequate vaccination cover. And all of this is rooted in poverty.
Primary health care. And I just want to draw attention to the fact that Mr. Harshvardhan, the health minister, in 2014 noted that this was a problem and promised to find solutions, including vaccination. Those promises were not kept.
Yeah, so this example, this particular encephalopathy is a very good example of an opportunity to reverse a condition. I'll tell you why. Because we have a particular geographical area, we have located or realized the actual reasons that happen. Now, if you are able to focus on these 3-4 districts, I'm not talking about encephalitis like Japanese encephalitis or infectious diseases. I'm talking about this particular problem in Muzaffarpur. If you are able to focus on these districts and able to make sure, I'm just surprised that today we have reached a political level where elections are fought, where there is a concept of a Panna Pramukh. There each and every voter is reached out to, which is good. I'm saying, why can't we do this for a few lakh people in a particular area only, when you can reach out to 90 crores of a voting population? We just need to make sure that these people, these children are not malnourished, we get them good food, we get them vaccination, we look after the primary. And you're right, you said 1.2% is the health budget. Sri Lanka is 4 times bigger health budget than us. How can you manage? And it's very clear that the focus of the people who lead the country, and I'm not at all talking about any political party, it's the overall view, because it's been the same for so many years. How can we have a country which gives only 1.25% to the health budget and to education budget? This tells us, when you talk about the minister's apathy, that's because there is hardly any attention given to it. And it's very important for the powers that be to realize that we have to bring health into a focus. Mr. Mishra, and I believe you're a doctor, so I just like to tell you that I don't doubt your intentions. I believe you have good intentions. You're the spokesperson. So while putting out your point of view, I am happy if you're also able to take in some things which we might share. In the message I'm sharing to you from the Indian Academy of Pediatrics is, we want to be involved with the government and try and help you get it right. And I would be happy if you can take this message. So the other point that I'd like to tell you is that, and I don't blame you for not knowing the medical details because you're not a doctor, as you said. A paper has been written and published by Dr. Jacob John, past president of the Academy, Dr. Arun Shah, who's from Muzaffarpur, and Dr. Das from Delhi, where they have established the role of these toxins, which I mentioned earlier. That paper is in academic and public domain. My point is, having a 100-bed ICU is a great step. I'm sure it will benefit hundreds of babies. But what we are talking now is a different issue, and that has to be tackled from today till next February in these districts where we are seeing the problem. And I have had an opportunity to meet the Honorable Chief Minister, Mr. Nitish Kumar, on the issue of malnutrition about 8-9 years back. Unfortunately, in the last few years, that has gone down. My point is, if Bihar looks at a very good nutritional model at all across the state, and not only Bihar, most other states in India also, I'm not singling you out, but if you look at these regions, if we look at these districts and ensure maximum 100% vaccination, not only of Japanese encephalitis, but the regular vaccination program of the government, if we look at the food, the nutrition of pregnant ladies and lactating mothers, if we look at the nutrition of under 2, which doesn't get covered in the midday meal scheme, it gets in the Anganwadi. But we have to reach across, and the reason I'm making this plea to you is because it's a social issue, it's to deal with poverty. So unless you take it from the government,
I request the Mirror Now team kindly share a number with me. I'll take you to the health minister.
Willing to come and meet you in Patna.
Fair. Listen, no. What I'm saying is, no. What I'm saying is, if the honorable prime on your panel, if he has some good views, I'm ready to take him along to the health minister. He can express the views. For the welfare of India, we are ready to do everything. 24 hours of our life we dedicated to Sabka Saath, Sabka Vikas.